Hello, students of ECPI University and Professor Hinton. My name is Heather Solomine, and I appreciate you listening to this short video. Poppy's a friend of mine, and he knows that I've been injured by pharmaceuticals, and he learned more about my story recently and asked me to share a little bit about what's happened to me and to answer some specific questions for you guys. So I'm a pharmaceutical injury survivor. I'm actually not officially healed. I am still tapering off of multiple pharmaceuticals that have made me tremendously sick. The destruction to my life it's comprehensive. I've lost my marriage, my job, financially I've been destroyed, friendships, reputation. I'm just a complete life destruction from legal, prescribed, taken as prescribed pharmaceuticals. And this is an epidemic that is happening all over the world that people are unaware is happening. People think that it's just about addiction, and it's not. I am not an addict. In fact, I buried my sister to addiction, so I'm pretty straight edge, you might say. So for me to end up as dependent and sick and entangled with these pharmaceuticals, it speaks nothing to addiction. It had nothing to do with my behavior. I never abused the drugs, as is the case for the majority of people that I come in contact with in all the support groups who have been basically injured or killed. I know multiple people personally who've died just in the last year from pharmaceuticals. So it's a very serious situation, and I'm going to answer some specific questions for you guys. First one is, who does this involve? It involves any doctor or medical professional who has the ability to prescribe mind-altering pharmaceuticals, and it involves patients of all ages, races, children, teens, adults, seniors, even pets are being put on everything from benzodiazepines to antidepressants and pain medication. Men, women, people of all races, addicts, non-addicts. Again, you cannot put it in the addict category. That's not what we're talking about. We're talking about iatrogenic injury. It's completely different. When and where is this happening? It's happening in private practices, OBGYN offices, psychiatry offices. Could be a casual primary care visit. Somebody just goes in, maybe they're having a personal problem, and they end up on a benzodiazepine for their anxiety. In particular, benzodiazepines they're so overprescribed. You know, with off-label prescribing legal in this country, doctors can pretty much prescribe whatever they want for whatever symptom they want. And benzos are prescribed for everything from restless leg syndrome to grief. Insomnia is actually the most common symptom that I hear of in the support community. It's not just for anxiety. It's also happening in pain centers. Patients go into pain centers and end up like significantly polydrugged. Hospitals, the VA, veterans are getting hit very hard by this epidemic. They're terribly overprescribed. Nursing homes and foster care situations. Foster children are ending up on psychiatric drugs now. It's just one way of controlling them. And detox centers. People end up dependent on these drugs, benzodiazepine in particular, and then they go to get help in a detox center, and what happens to them? They're abruptly discontinued off the drug, ripped off of it, and put on other drugs to treat the symptoms from the rapid discontinuation. So it's a perpetual cycle that's happening really in all practices of medicine. This is happening. Why is it happening? Well, the first reason is misinformation. Unfortunately, a lot of the facts are not getting where they need to be. The curriculum is inadequate. I hate to say it, but it is. For example, do you know that benzodiazepines, per the pharmaceutical manufacturers, are supposed to be taken for 2 to 4 weeks maximum? not long-term. And yet, countless people are kept on them for months and years and decades. I know people on benzos for 30 years. Pharmaceutical companies state in their literature, and it also says on the FDA's website, if you look it up for Klonopin, it says short-term use only, which is a matter of weeks. So dependency is developing very quickly. This information is not common. Most doctors don't know that. So that's number one. A lot of medical professionals don't know that antidepressants and antipsychotics cannot just be abruptly discontinued and then crossed over to another drug. It doesn't work that way. The chemistry of the brain is very delicate. Combining of drugs, just recently it's in the spotlight that benzodiazepines and opiates is a dangerous combination, yet people have been on this combination for decades. It's a real problem. Pharmaceutical companies are not forced to disclose all the information from their clinical trials. So all the side effects and all the problems with these drugs, it's not all getting to the doctors. So that's one of the reasons that this is happening. As far as the curriculum, the full scope of neurotransmitters is also not being taught. So as a medical professional, you have to do your own research. Like, for example, do you know that serotonin affects body temperature? It affects appetite, digestion. It also affects vasoconstriction. And GABA, which is what benzodiazepines affect, GABA is an upstream neurochemical. It affects so much in the body. When I was in acute benzodiazepine withdrawal, my stomach was in excruciating pain. We call it benzo belly in the community because there are more GABA receptors in the stomach than any other place in the body. Now, I could have gone into a doctor's office, and I did, complaining of those symptoms and just be medicated with another drug. Not, the symptom not being recognized that it was from the GABA deficiency that I was suffering from. So know your neurotransmitters, know what they do in the body. GABA also controls smooth muscle mass. I had incredible muscle pain when I was in acute withdrawal. I mean, all my muscles were seizing up. It was unbearable pain. Nobody knew to say to me, that's from GABA. You're suffering from a GABA deficiency crisis right now, and that's why you have that pain. We need to be educated about the full scope of the neurotransmitter that the drug is manipulating. Benzos also affect coagulation. A friend of mine abruptly discontinued Valium recently, and she ended up with a pulmonary embolism, and she died, and then they resuscitated her. Do you think that the medical professionals are thinking that the Valium discontinuation is at play there? No, but if you Google GABA and coagulation, you will find PubMed articles on just that. What to do? Oh, wait, one more thing on why. Because side effects and adverse effects from these drugs are also not being studied and memorized. For example, I have a friend who was on Wellbutrin and her hand swelled up, and she went to doctor after doctor asking about her hand, rheumatologists, all different specialists, and nobody really knew what to do for her. And then she finally found a doctor who said, that's a side effect from Wellbutrin. And when she stopped the Wellbutrin, her hand got better. One doctor out of many doctors picked up on that side effect. So side effects are not being focused on and really studied. That's another why. What can you do? Think about these drugs in a totally different way. They're not benign. You're not going to learn everything about them in med school. Go online. Go on Facebook, for example, and just type in the name of a drug on Facebook. If there's a support group for that drug, there is much more to learn. And I can tell you that there's a support group for probably every brain-altering pharmaceutical on Facebook. Learn adverse effects, not just side effects, but there are things happening to people from these drugs that actually are seemingly irreversible. I know people who are brain damaged, people who are debilitated for years and years after discontinuing these drugs. So there are adverse events happening, and they're not as rare as we're being told by the pharmaceutical, advertisements and possibly by the reps. It's not. Doctors think that it's rare. It's not as rare as you think. I'm seeing droves of people pouring into these groups every day. What else can you do? Say no to polypharmacy. If you come in contact with a patient who's already on a drug and they're having bizarre symptoms, really investigate if that drug is at play before then prescribing another drug. Because what's happening is we're medicating symptoms caused by an original drug, and we're ending up poly-prescribing to people, and they're ending up on so many different drugs. I know people on 8, 9, 10 different mind-altering drugs. It's craziness, because then they have to taper off each one of those, and it takes years to come off these drugs. Also, get your hands on a manufacturer's pamphlet. This was a major aha for me. So the pharmacy gives you their printed out pamphlet, right? Walgreens gives you all the Walgreens information you need to know about said drug. Well, the manufacturer gives you a much more comprehensive pamphlet, but we don't get that pamphlet usually. Just so happens that I had a prescription filled recently, and it was filled with the actual manufacturer bottle. And on the top of the bottle was a tiny little pamphlet folded up. And when I opened it up, it was this massive amount of information with information about drug interactions that I was experiencing right then and there. It was interacting with my thyroid medication. This drug is amitriptyline. That information was not in the Walgreens pamphlet. So getting the full information from the manufacturer is pretty key. I think that every prescribing medical professional should have those documents on hand so that they can reference them. This is quite complex. I mean, we are messing with the central nervous system and brain chemistry. So, I was supposed to do a 5-minute video. I'm over my time. I didn't want to lose your attention. I wanted to, at least get you interested to learn more. And that would be my last thing to say, is just keep learning more. There's so much information out there. And the feedback loop, we need to work on that, the patient medical professional feedback loop, because patients have a lot of information to bring to the table. So thank you so much for listening. Have a good week.